Vaccine Institute can largely be described as one of the legacies of COVID-19 pandemic. At the height of its outbreak, President Akufo-Addo declared its intention for Ghana to manufacture her own vaccines. This led to the setting up of the Vaccine Manufacturing Committee in February 2021, which has now become the National Vaccine Institute after the passage of the Act by Parliament. Inaugurating the Institute's 30-member board at the Jubilee House, President Akufo-Addo charged them to ensure that the plan to transform Ghana into a vaccine manufacturing hub becomes a reality.
The task ahead of you is a challenging one, and it is my expectation and hope that you will be up to it. You have my full support to undertake all that is required to make our nation the vaccine manufacturing hub, not only in West Africa, but also on the entire African continent. Indeed, much of the realization of this objective rests squarely on your collective shoulders, and I'm happy about your choice to serve your country in this capacity. You've been carefully chosen because of your expertise, knowledge, and accomplishments in the areas of concern of vaccine development.
The chairman of the National Vaccine Institute, Dr. Anefia Samoaba, said the board is aware of the drive by Ghanaians to manufacture vaccines locally and work hard to achieve this goal.
As a board, our assignment is work cut out for us. We are to ensure the efficient and effective implementation of the key functions of the Institute as outlined by the President. We recognize that our remit is a subset of the broader national vaccine agenda. As a nation, we still have challenges with vaccine literacy, with vaccine hesitancy, vaccine shortage, and vaccine financing. And we pledge to collaborate with the agencies and institutions that have prime responsibility for these areas, so that not only do we do our work, but we also help to advance the vaccine agenda.
From the Jubilee House, the President went to Switchback Road at Cantonment in Accra to formally open the office of the National Vaccine Institute. Ghana spends $30 million annually for various vaccination programs, but this support, which usually gets financing from donors and Gavi, will cease by 2027 due to Ghana's status as a lower middle-income country. Health Minister Mr. Kwekwajiman Menu pledged the ministry supported the National Vaccine Institute.
The Ministry of Health developed the National Vaccines Policy to translate the President's vision of making Ghana a vaccine development and manufacturing hub towards self-reliance into reality.
President Akufo-Addo said the dependence on donors for vaccines was not sustainable, hence the move by his government to make Ghana self-reliant in terms of vaccine production.
Our short-term goal is to fill, finish, and package COVID-19, malaria, and tuberculosis vaccines within 2 years. The FDA will also establish a vaccine lot release system and will strengthen further research and development for vaccine production. We also want to establish a technology transfer partnership with vaccine development and provide in-house and external training program for staff. In the medium term, that is in 5 years, the target is to continue the establishment of more domestic vaccine manufacturing plants in the country to manufacture vaccines to meet WHO GMP standards, with a long-term target being to produce a candidate vaccine in 10 years using innovative technologies.
The National Vaccine Institute was set up with a seed funding of $25 million. The chief executive of the National Vaccine Institute is Professor William Ampofu. Edward Nyakun, reporting for GBC News.